Hello and welcome to the Nurse Rosa's Insights podcast. I'm your host, Rosa Hart, and today I am joined by Helen Dao. Thank you so much for being with me today.
Thank you, Rosa. Thank you for inviting me.
Yeah, I'm so glad to get to learn from you today. You are a master of healthcare consulting. I mean, you literally wrote a book by that name, so it must be true, right? So, share with us your background and how did you decide to go into healthcare? Like, obviously, you've been working in a non-clinical capacity from a population or public health side of things. So, why did you decide to work in such a challenging industry?
Yes, that's a very good question, Rosa, because us not having a clinical background, definitely have been asked that question. And it was probably in 2007 that I was working with a community based organization serving children, adults with epilepsy. And one of the projects that we were working on was the patient centered medical home model. And that allowed me the opportunity to collaborate with the clinical team, with hospitals and community based health centers, and better serve this population, children, adults with epilepsy. Through that work, it sparks my curiosity and my interest to how can we better serve the communities, especially communities, residents that live in the low income communities, vulnerable populations. And also, I experience the barriers and the challenges that they go through on a day to day trying to access healthcare services. So, my career in healthcare consulting started back in 2007 because I wanted to be part of the solution. I felt that with the little bit that I knew and the much more that I needed to learn, I could make a difference. So that's how I started healthcare consulting. And yes, my background is I have a doctorate in public health. And part of my work as a healthcare consultant is collaborate and partner with the clinical team and the executive leadership to help them achieve the mission and the goals that they have to improve better care for our patients.
And you're talking about the federally qualified family health centers.
Yes.
And so those serve, lower income patients, like, are all of them on Medicaid or most of them?
Yes, so the federal qualified health centers or the FQHCs, the majority of the patients they serve and the families are on Medicaid, and the federal qualified health center designation is given by the federal government, and it is based on zip codes. It is based on the location that they are and who they're trying to serve. Um, but they it's population that is 200% below poverty level.
Hmm.
That's who the FQHC serve throughout the nation. We have about 1,600, I believe, FQHCs throughout the United States.
And do they mostly serve as primary care centers?
Yes, most of our FQHCs, they provide primary care services, but also they provide specialty services such as cardiology, GYN, OB, neurologists, and they also provide behavioral health services.
Really?
Hmm.
So I'm only aware of the primary care services offered around here, so this makes me want to investigate further to make sure I know what all is available for our patients. So I'm glad you told me that. I always learn something in every episode. That's why I keep doing this. So, can you share with us a story or two from some ways that through your consulting you were able to help the FQHCs?
FQHCs.
Yeah.
Yes, absolutely. Some examples that I can share with you is that we were working on a project with a large FQHC, and they were going to start the process and how to become a patient-centered medical home. which is a designation, recognition provided by the National Committee for Quality Assurance. And one of the gaps or the major gaps that they have was care coordination. So that is truly the heart of the services that they provide to the patients. And what we did, we helped them create a care coordination program with the emphasis that it wasn't just with the purpose of meeting PCMH requirements, but actually doing a systems change at all levels of the organization. They have multiple facilities as well. And what that did was to help the leadership to expand services to the patients and families, and they'll also do the community outreach by following up with the specialist referrals, by follow up on orders, and also having a team of care coordinators who were managing patients with chronic conditions. As you probably know, Rosa, a lot of individuals with chronic conditions might be the elderly population or individuals that have two or more chronic conditions that might be very difficult for them to get to their appointments. So through that program, services such as transportation were provided for them. So we were able to successfully provide the structure, provide the training, and maintain that system change. And they did meet the PCMH requirements, that they did were recognized. But 12 years later, that program continues to strive and continues to serve the community.
And is the care coordination being done by social workers or community health workers, or what was it that you were able to set in process for them?
Yes, that's a great question because when we think about care coordination or case management or chronic care management, there are different ways. These are non clinical staff that are trained and that they have the knowledge and the skills in how to coordinate medical, non medical, behavioral health services for the patients that they serve. So it's a team of non clinical, but it's a very detailed work because they have to follow up with the patients that are assigned to them and to also be that linkage between the patient, the primary care provider, and also with external specialists that they're referred to.
Yeah. And it is so important to have people in that role who know how to listen for what is not being said in
Hmm.
these follow-up phone calls. In my day job, I definitely have spent a lot of time making routine phone calls, and there are certain questions that, I have to ask with a set question, looking for a set answer. But people often answer questions in story form and tell you about their life experience. And so it involves some, like, identifying issues, right? They might not say that they have trouble getting to an appointment, but you see
Hmm.
they just canceled that appointment, and
Right.
then you ask them why, and they're like, "Oh, well, I didn't have anybody who could, or I can't get there because I can't drive." And
Right.
then you ask a qualifying question of like, "Well, do you have someone you can ask to give you a ride if they?" And they're like, "Oh, I don't wanna bother them."
Hmm.
And so it's not so much that it can't be done, but those conversations need to be had, and encourage people to take care of themselves and read between the lines.
Yes.
So you're
Yes.
right that it is detailed work, but not even necessarily in a way that you can, like, write down and
Hmm.
check all the boxes,
Right.
because it requires a little bit of intuitiveness.
Yes, that's correct. And I think that sometimes when the patients have a designated care coordinator or case manager, also it's an opportunity because, and you mentioned something that I think is very important, that many times patients will not show up to the appointment, but why? So there is a lot more than we can understand by this just not showing up to the appointment. But what are some of those barriers that they're experiencing? And this individual serves as that channel in facilitating those services, enabling services to the patients.
Yeah, exactly. So, Tell us some more about what your book is about as far as mastering healthcare consulting. What kind of things do you teach in it?
Yes. So I do have to disclose, I learn every day something new
Yeah.
in healthcare because, as you know, is healthcare can be very unpredictable.
Mhm.
So in the book, Mastering Healthcare Consulting is really about creating a framework for uh, um, independent consultants, for someone that feels making a transition to doing healthcare consulting and being able to be part of those decision makers along with the leadership. So it really provides specifically around federal qualified health centers. So I do talk a lot about that because that is a lot of our clients are very qualified health centers, and helping to sort of tease out the system of an FQHC. How do you work with an FQHC? How do you understand the culture? Who do they serve? But also the culture within the FQHC when it comes to the leadership, the staff, and management. It provides that path to start understanding more that federally qualified health centers serve the population and how vital they are to the healthcare system in the United States. But also, I talk a lot about how do you go about overcoming some of the challenges. FQCs are very regulated by the federal government, so it can be very intimidating trying to meet deadlines, understanding what compliance they need to meet, and also the language and the vocabulary, as you probably know. It depends whether it's a hospital, a specialty clinic, or FQC. It can vary. So it can be a little intimidating. I believe there is a great need to have experts in that field. When I wrote the book, some of my colleagues said, well, you talk a lot about how you do work for the FQHCs. Isn't that telling other people what you are doing? so, as,
Let
and
me
as
just guess, there's so much work, you are in no danger of working yourself out of a job, right?
No, not at all. I think it it will be a disservice, and keeping that knowledge and experience that FQCs had taught me and my team, but really empowering young or new consultants, especially in the times that we're living now, Rosa, that post COVID, the labor landscape change. So we do a lot of work remotely. We offer specialty service. So we want to be able that other consultants that are trying to really have that passion and their values match with the mission of the FQCs, that they can also contribute and work with the leadership in making a difference in the lives of the individuals they serve. Mhm.
It does sound like a really great option, and I bet do you have to have a degree in public health in order to do things like this, or is there room for, doctors and nurses and other people with clinical experience to, jump in and help with this kind of work as well?
Absolutely. I think that, I would say, and I have heard this before, I'm a little kind of an outlier how I started healthcare consulting because I don't have a clinical background. And sometimes that can be perceived as a negative thing, but it's not, because the work that I do is more at the compliance level.
Mhm.
But when it comes to the clinical individuals, as you mentioned, a nurse, a physician, yes, there is great need at the clinical level also for FQCs, because uh, often we're looking at the clinical workflows, changes that happen within the organization, especially now as we experience a tremendous shortage in staffing in the workforce to work in the healthcare. But when we look at a micro level within the FQACs, it's a serious problem. So
Mhm.
having clinicians to provide that expertise and supporting how we can adapt to the changes at the clinical level is very important. Sometimes we also might see that within the FQHCs, l- clinical staff is promoted to leadership roles as well, while they still are expected to do the clinical work. So,
Yeah.
having some kind of mentorship, I believe that also more peer-to-peer mentorship, it's a great opportunity. So for me and my team, our focus is on the federal compliance level when it comes to meeting, staying in compliance, and assisting the process. But again, collaborating. We also very often collaborate with other consultants as well that they have their own expertise.
That is awesome. So it brings us to the $1 billion question that I ask everyone on the Nurse Rosa's Insights podcast. I have an inkling as to what your answer might be. But Helen, if you were given a grant for $1 billion to meet the needs that you see in healthcare, how would you like to see it used strategically to have the most sustainable impact?
Yes, that's a very, very good question. It's definitely is worth $1 million. Um, Definitely, I can think about different many ways that I could spend that. But one of the things that really stand out for me, and I don't know if it goes along the lines that what you were thinking, is providing tools to the staff. And what I mean by that, and I'm talking right now, non-clinical staff, because non-clinical and clinical different needs that they have. A lot of the work in the healthcare is also done by the non-clinical staff of the support team.
Yeah.
The individuals that support the clinical staff, and is designing trainings that will help help the staff to understand what the specific roles are. We have come to a point where we hire individuals, even some hopefully not clinical, but non-clinical staff, and we say, okay, this is the work that you're going to do. We don't spend enough resources in order to train the individual properly and set them for success,
Mhm.
because when we hire someone, it's because we believe they have this set of skills, but we also want to position in a situation that they will be successful, because if they are successful at their work, it's going to impact us as whether we are hospital, whatever clinical setting it is. So I would say that is developing trainings that are not that simple and that focus specifically in the skills that we are trying to develop for that individual, not just listening to a recording, but to truly make that person develop the skills and become feel competent, like, yes, I have the skills. And of course, it's an ongoing learning process. So if maybe starting a training institute using the money, where also it will be a no cost, uh, and for the individual, where they can come and be trained and receive the resources, and along with that, a mentorship program for staff, because we have at all levels staff that truly want to do the work. They really are passionate. And as you mentioned at the beginning, working healthcare is not easy. So we want to keep the staff that come to healthcare, clinical, non-clinical, because a lot is invested when they are hired. So we want to make sure that we keep them as well.
Yeah. And I know some places try to implement like a peer mentorship program. Like obviously, like in a clinical role, like I had a preceptor who was assigned to clinically mentor me into like assimilating onto the floor, right?
Yes.
But I know they tried to implement different peer mentors, more camaraderie, encouragement, how to cope with life type of peer mentorship. Um, but if it's not, like, already scheduled for you into your work day and you just expect it to organically happen, it really doesn't. So, I like your idea of having the structured mentorship, um, especially if it's scheduled and it's like you're gonna show up and you're gonna give encouragement to this person and make sure that they know how to do their job the best absolute way. Because if people feel competent, like they know what they're doing, and they feel like their boss or their team
Mhm.
feels like they're competent and they're making a difference, then they're gonna want to stay and come back to work and not give up and leave, because who wants to go to work feeling like they suck at it every
Eh,
day, right? Or
No,
that
no.
they're doing an impossible job that just
Mhm.
can't be done.
Yes, yes, I agree. And, it makes me think about the initiative when it comes to preventing providers burnout. Or the clinical staff. So we can also think about the non-clinical staff, the front desk staff, the frontline staff, because working with people, as you know, is not an easy thing. It takes a lot of energy, and sometimes people might not be having a good day,
Yeah.
uh, and something might happen, not go well, and we want to make sure that when we hire and spend time training someone, we spend a lot of money doing that. And especially after they leave for 3 months later, what I have seen and heard throughout the years is the staff that will resign is they're burned out. They feel overwhelmed. There is a lot of in healthcare we wear many different hats, right? It's just not one thing. So how do we prevent that from happening? As we're trying to build the healthcare workforce, we also should think about how do we sustain it? How do we keep the people that we train and invest in so many resources to achieve that? But we have to keep them
Mhm. And nurture them.
and nurture them. Yes,
Yeah.
absolutely.
Need a care coordination plan for the staff.
Yes. That's right. Yes, that's right.
Better
Yes.
come up with that than a care coordinating planner person. So,
Yeah.
yeah. Well, I really appreciate you sharing your wisdom with us today, Helen, and I really hope to see investment in that going forward, because you're right. Those FHQCs are so important to FQHCs. Sorry, I messed up my acronym. But those federally qualified health centers are so
Yes.
important to meeting the needs of a large part of our population. I mean, it's not half the population, but it's a lot of people.
Yes.
And it's a lot of the people who would be probably frequent flyers, as we would say,
Mhm.
hospitals, because they would come in the hospital with an issue, get it addressed as emergently, then leave, and they don't have a primary care provider. They don't have insurance. They can't afford to get their medications, so they don't. So they end up back in the hospital.
That's right.
So the work that's being done there to mitigate that and help people actually live a healthier life is so important.
It is. And you bring out a couple of great points because the individuals that come to the federally qualified health centers, they have an array of medical and non-medical challenges and barriers as well. And some of those many of those individuals that the majority, I would say, it depends from the FQHC or for a qualified health center, but most of the patients have Medicaid, and those are the patients that if they're trying to get an appointment at a private practice or what have you, they're not going to be able to do that because maybe that provider does not accept Medicaid or an HMO. The federally qualified health centers, they provide, as I mentioned before, all the services that an individual needs for them and for their family, children, and they are able to access those services in order to improve. Some of the stories that I do hear for saying health centers is that, as a matter of fact, I was at a health center 2 days ago, and I was speaking with the chief medical officer, who happens to be a pediatrician, and I came to say, he introduced me to one of his patients. He said, the father used to be a patient here. Now he brings his son um, as a patient. And it was such a beautiful thing to see the second generation coming. Why? Because that speaks high value of the quality of services that federally qualified health centers provide to many communities throughout the country. But it can definitely be a challenge for individuals trying to access healthcare.
Yeah. So, if someone is interested in becoming a consultant for healthcare, where can they find your book?
Yes, so we have our book in Amazon and also in Barnes and Noble. In Amazon, we have it as an ebook. So if you are the person that more with technology, and then Barnes and Noble, so you can order a paperback.
All right. Well, thank you so much, Helen. And if someone wants to reach out to contact you, what's the best way to reach you?
Yes, so our website, they can go to our website at dowconsultingservices.com or info@dowconsultingservices.com.
Excellent. And I'll have a link to that in the show notes below. So, for those of you listening, if you liked this episode of the Nurse Rosa's Insights podcast, please like and subscribe it wherever you're listening. If you're watching on YouTube, make sure you follow along. And I'd love it if you would leave a comment as to what you found valuable or what you'd like to learn more about. And if you know someone who has a $1 billion idea that could transform healthcare, send them my way. You can find me on social media at Nurse Rosa Speaks, or you can reach me through my email, which is info@nurserosaspeaks.com. And I'll see you in the next episode.